My name's Tyler Graber. I've been here for 3 years. I've been a nurse for 3 years. I've worked on our critical care unit the whole time. It's been a challenge the last couple months, but I enjoy it. I love working there. I love the people that I work with. Interacting with my patients, getting to know them. I think in this time that we're in, with lack of visitors and the visitor policy, you have to be able to understand your patient, to understand their needs. The social aspect is almost more than the physical aspect of it right now because they have nobody there with them. So I go in each morning, I introduce myself, I try to ask them questions to get to know them better, because I think that's one of the most important things as us as nurses can do, because we're in there at least every hour, and sometimes we're in there 30 to 40 times a day. Sometimes we barely get out of there. So you have to get to know your patients on a personal level. I think back, it's hard for me to even remember what it was like to not have to put a gown on, to not have to put a mask on every time, to the face shield, the N95. It's so much more difficult. You have to prioritize is the key for my job right now. Man, each time you hit that door, you crawl out of your car, you're walking in across the parking lot, your mind already starts to wonder, what am I going to see today? Am I going to see another death? Am I going to see another patient put on a ventilator? It's tough because there's so many cases right now. We come in, we might have 3 or 4 empty beds. You know those are going to be filled immediately. Quick as you hit that door, you don't know what kind of patient you're going to get from ER. You don't know how sick they're going to be. So it's been really, really tough. The amount of cases we see, it just keeps climbing by the day. It just seems like it won't stop, and you don't know what's going to happen when you walk through that door. It's kind of an unknown each day. Tiring, exhausting. Put that N95, it starts, after a 12-hour shift, it starts eating into your face. The face mask, you get my ears right now back here, you can't see it, but just from wearing these regular masks, I have little sores behind my ears. So it's tiring because each patient the floor that I work on, pretty much every patient is a COVID patient. Not always, but for the most part, and we treat them pretty much like that anyways. So you're expected to put on your full gear, and to try to do that and back to what I was saying earlier about prioritizing between patients, that's what's tough, is having to garb up every time you go in and out of a new patient's room, and it takes time. I don't know what the exact time frame is. I feel like I've gotten pretty quick at it, but it takes a certain amount of time, and by the time you do that, then your patient can really start to deteriorate. So tiring is the word that I use to describe that. Seeing the death toll. I know I had a patient, I won't try to go in much detail, I had a patient that passed away. He fought for 4 or 5 weeks. He did everything that we told him. We got to know him, back to what I said about getting to know your patients on a personal level. You get to know him, and he listened so well. He did everything that we told him. He proned, he laid on his stomach to help his breathing, and he just progressively got worse, and up until the end, after around a couple weeks, they had to put him on the ventilator, and it wasn't much longer after that then he ended up passing. And it's so tough because you get to know these patients on that personal level, and you work so hard with them, and they can't overcome it. They do everything that you tell them, and it's still not enough. And that patient, I think when that patient passed, there were three of us in there along with his spouse, and it was a beautiful moment. Those last moments, we were all gathered around the bed. The spouse got to hold his hand. We said a prayer with her. I think we were in there for like 30 minutes. I don't think there was a dry eye in the room. Everybody in that room, we got to know and love this patient. And you see all that work that we put into it and all that work that he puts into it, and that's the end result. So that's been one of the toughest parts. That's a really, really tough one. I would love for the family to be able to come in. I would love, that's the hardest part, is making that phone call and saying, no, you cannot come in, it's too much of a risk. Because I'm very much a people person, and I know that part of helping them get better is if they could see their family. So I know that's one of the toughest. I hate that so much. So that's why I try to represent their family as much as possible. Hold their hand, let them cry on my shoulder. That's happened multiple times. Just be there for them, that presence. I don't care if I had to sit in that room all day. Try to be their family as much as possible. It's sad. You do everything you can not to come to that point, because the outcome once they're on a ventilator is very seldom good. When we put them on a ventilator, there's a tube that goes in their throat, and they have multiple other tubes and IVs and multiple other things going on. One of the first things we do whenever they're on the ventilator is we start proning them. Proning them is whenever we lay them on their stomach. That's not a pleasant thing. Us as nurses, we get the orders from the doctors to sedate and paralyze our patients, so we put them in a medically induced coma, and then that's when the proning begins. We try to turn them the best we can, but they basically just lay there on their stomach. We try to make them as comfortable as possible, but I know that it's not a pleasant thing for the public out there. I think that if the public could see some of that, it might change their outlook on whether or not COVID is real, because it is real. Being on a ventilator it's not a pleasant thing for the patient, and it's not a pleasant thing for us as nurses and medical staff to look at. Numb would be the word that I describe sometimes, because with the amount of patients that we've lost, you have to be careful how you let yourself feel, because it's happened so much. You have to learn how to cope with it, because whenever you're there holding that patient's hand as they go into eternity, you want to cry and let out all your feels, but then again, you still have to remain strong, because you know that there's another patient waiting right next door that might be going through the same thing. So you have to put on your game face and just repeat and keep doing the same things. But losing a patient, it's unexplainable. Like I said, you feel like you put in all this work, and the patient has too. And then that's the end result. So used to be whenever I first started as a nurse, I could go home from my job and I kind of let my work here. I didn't go home and think about it too much, or I tried not to. There were some days that I did, but now it's like you get home and my mind's racing at nighttime, yet wondering, what else could have I did for that patient? Could have I asked the doctor for another medication? Could have I been in the room more? Could have I called the family more? And so it's tough. Now I take it home with me, and I think about all these deaths. if it was possible to let the public walk through and just peek through some of these windows, I feel like their outlook might change a little bit. When you see a person on a ventilator, when you see them laying on their stomach, or whenever you see a patient that's on high flow oxygen or wearing a BiPAP mask on their face for days in and days out, and these patients, from wearing the mask, they have sores on their nose. If they could just come in and get a glimpse of that, I think their outlook would change just a little bit. Once again, I go back to that. I wish that people could get a glimpse of what us as healthcare workers look at each day in and out, because this virus is real. It's not looking like it's going anywhere anytime soon. So I wish that was possible, that we could either have a video. I know that's not, but just to get a glimpse of what people do go through here in the hospital. It's not a pleasant thing. For us as healthcare workers, I know back in March and April when all this started around here, it wasn't as prevalent. There weren't as many cases. It's here now. Be vigilant, keep your guard up. If you're sick, stay at home. Monitor your symptoms. Be careful around your loved ones. I know that's, for me, that's why I try to take it so serious here at work, is because I go home to my loved ones. I don't want to spread it. I don't want anyone to have this disease. I don't want anyone to have to be put on a ventilator. I don't want anyone to have to be proning, laying on their stomach for hours and hours at a time. I don't want anyone to have to wear that BiPAP mask for days and days just to be able to breathe. So just be careful, be vigilant.